Good day, everyone. I hope you are all doing great today. Have you ever heard of a condition where a child looks chubby or swollen but is actually malnourished?
Sounds confusing, right? When we think of malnutrition, we usually imagine someone who looks very thin.
But did you know that not all malnourished children look that way?
So why do you think protein is important in our diet? Is it just for muscles or does it do more?
Today, we are talking about a condition that may surprise you. It's called
Kwashiorkor.
I am teacher Aiden.
I am teacher Ian.
I'm teacher Joe.
I'm Teacher Kai.
I'm Teacher Elio. And I am Teacher Angelito.
And today we're going to explore what Kwashiorkor is.
Let's begin with the nature of Kwashiorkor. Kwashiorkor is a type of malnutrition characterized by severe protein deficiency. This means the child doesn't get enough protein even if they eat enough calories. It mainly affects young children, especially those who have been weaned off breast milk and are given food that is rich in calories but poor in protein. So, these kids eat enough energy food like rice or porridge but little to no meat, eggs, or milk. The nature of Kwashiorkor is rooted in nutritional imbalance. There's a mismatch. Enough food but not enough of the right nutrients. While the child may be eating enough in terms of energy, the absence of protein in their food causes the body to break down its own muscles and tissues to meet its needs. This results in muscle wasting. What makes Kwashiorkor unique is the presence of swelling in the limbs as well as the face, hands, and abdomen. This is called edema, where fluid builds up in the tissues. This swelling, known as edema, is caused by the body's inability to maintain fluid balance due to the lack of protein, particularly albumin in the blood. Albumin helps keep fluids in our blood vessels. Without it, water leaks out. Kwashiorkor does not develop overnight. It takes time and usually follows poor diet or illness. It usually occurs in environments where food supply is limited or where cultural practices lead to unbalanced diets. For example, in areas with poverty or where children are fed mainly starches. It is mostly found in developing countries with high rates of poverty and food scarcity. So, this includes areas with limited access to nutritious food. Poor sanitary conditions and a high prevalence of infectious diseases also help set the stage for malnutrition. Kwashiorkor can affect all ages, but it's most common in children, especially between the ages of 3 to 5. This is the age when many children stop breastfeeding and start eating regular family food. This is an age when many children have recently transitioned from breastfeeding to a less adequate diet, one higher in carbohydrates but lower in protein and other nutrients. This type of malnutrition is an opposite of marasmus, which results from a deficiency in all the macronutrients that the body requires to function, including carbohydrates, protein, and fats. In marasmus, everything is lacking, not just protein. The key difference lies not only in the deficiency but also in body appearance. In marasmus, the child looks extremely thin with visible ribs and severe weight loss. There is no swelling, just severe wasting. In contrast, Kwashiorkor causes swelling, especially in the legs, feet, and face due to fluid buildup called edema, making the child appear puffy rather than thin. In many cases, it follows an illness such as diarrhea or infection, which further reduces the body's ability to absorb and use nutrients. So, sickness makes it even harder for their body to use what little food they eat. The nature of this condition reflects the body's urgent and damaging response to protein deficiency. Unlike other forms of malnutrition where the child may appear extremely thin, a child with Kwashiorkor may appear puffy due to water retention. This is why it's sometimes hard to tell the child is actually malnourished. When left untreated, Kwashiorkor can be fatal. It can lead to death if not managed quickly. Death may be caused by infection, dehydration, or liver failure. When treatment begins, people are also at high risk of complications from refeeding syndrome. This is when the body reacts badly to suddenly receiving nutrients after starvation. However, those who are successfully rehabilitated can make a strong recovery. Some may bounce back well, but others may not. They may have some lingering effects from Kwashiorkor, but they may not. The complications of Kwashiorkor are more severe and last longer the longer they've been left untreated. The sooner it's treated, the better the outcome. Some children may never fully recover from their growth and development shortages. They may remain predisposed to liver disease and pancreatic insufficiency. So, even if they survive, they might still have health problems later. Earlier intervention leads to better outcomes. Kwashiorkor needs to be understood to be treated effectively. Simply feeding with protein may be insufficient and even dangerous. Professional care and balanced nutrition are needed. Kwashiorkor should be treated as soon as possible, especially in children. Earlier intervention can help minimize the long-term effects of malnutrition. In short, Kwashiorkor is a deadly condition caused by too little protein even if energy from other macronutrients are present.
So today I will be going to discuss the causes of Kwashiorkor, which is related to metabolism. So Kwashiorkor is a severe form of protein energy malnutrition that stems primarily from inadequate dietary protein intake, while caloric intake may remain relatively sufficient. So this imbalance profoundly disrupts essential metabolic pathways, particularly those involved in protein synthesis, lipid metabolism, and fluid homeostasis. So as we can see here in the diagram, the low dietary protein is the main cause of Kwashiorkor, which results into low ferritin and low protein, in which this low ferritin will result to low hemoglobin and worst anemia, while on the protein, lack of protein will proceed to hypoalbuminemia, which leads to low encotic pressure and will lead to edema. While for the low hemoglobin and anemia, the beta lipoprotein will be impaired and will result to fatty liver. So first, let us discuss the ferritin and the hemoglobin production. So ferritin is an iron storage protein which is crucial for iron homeostasis. Its deficiency results in decreased hemoglobin production and subsequent anemia. Anemia comprises oxygen delivery to tissues, reducing the efficiency of aerobic metabolism and overall energy production. So as you can see here on this diagram, we have here the ferrous ion and the ferric ion, which comes from the food that we eat, in which it will be transferred through the transferrin, and it will be utilized by hemoglobin in erythrocytes and will be stored on our livers. So simultaneously, hypoalbuminemia, a hallmark metabolic consequence of Kwashiorkor, arises from reduced hepatic protein synthesis. Albumin, which is a key plasma protein that maintains oncotic pressure, which regulates fluid distribution between vascular and interstitial compartments. A decline in plasma oncotic pressure leads to fluid accumulation in tissues, resulting in the characteristic edema observed in Kwashiorkor. As we can see again on this picture, which are the potential causes of hypoalbuminemia, it illustrates the potential causes and consequences of this condition, and it is characterized by low levels of albumin in the blood. We all know that albumin is a vital protein produced by the liver that helps maintain oncotic pressure, which is essential for keeping fluid within the blood vessels. When these albumin levels decrease, fluid shifts from the intravascular space to the interstitial space, resulting in tissue swelling or edema, which is a hallmark sign of Kwashiorkor. Moreover, inadequate protein intake impairs the formation of beta-lipoproteins necessary for lipid transport. This metabolic disruption leads to the accumulation of lipids in hepatocytes, producing hepatic steatosis or the fatty liver. In this picture, we can see here the difference between a healthy liver and a fatty liver. Let us further discuss the figure based on the characteristics that we can see on these two. In a healthy liver, there is normal distribution of fat and functional hepatocytes, while in fatty liver, fat accumulates abnormally within liver cells, a condition known as hepatic steatosis. This occurs in Kwashiorkor due to the lack of protein needed for the synthesis of beta-lipoproteins, which are essential for transporting fat out of the liver. The visual comparison shows the healthy liver as red and uniform in texture, whereas the fatty liver appears yellow and filled with fat droplets under the microscope. So these metabolic abnormalities illustrate the critical role of dietary protein in maintaining anabolic processes. In Kwashiorkor, the body's inability to sustain protein-dependent metabolic functions lead to a shift toward catabolic states, though not as extensively as in marasmus, which is a different part of, which is a sister part of Kwashiorkor.
First, one of the most recognizable signs is edema, or swelling. This often appears in the limbs, abdomen, and face due to the body's inability to retain fluids within the bloodstream. Closely linked to edema is a bloated stomach with ascites. The abdomen feels tight and painful because of fluid buildup. Next, look at the hair. Individuals with Kwashiorkor often experience dry, brittle hair and hair loss and the loss of pigment, sometimes appearing reddish-brown or gray. Alternating periods of good and poor nutrition can even create a flag sign with bands of normal and depigmented hair. The skin also shows distinct changes, known as dermatitis, often described as flaky paint dermatitis. This involves hypopigmented or hyperpigmented patches that peel and flake, resembling peeling paint, particularly in areas of friction like the groin, buttocks, or elbows. Dehydration is also a serious complication, occurring due to the body's inability to retain fluids properly. This can lead to low blood volume and actual electrolyte imbalances. Behaviorally, anorexia is also a symptom, characterized by severe calorie restrictions and very low body weight. Irritability and fatigue are also common early signs, with severe fatigue making daily activities difficult. Finally, for children, stunted growth is a hallmark symptom. A severe lack of protein in their diet prevents them from growing or gaining weight as expected.
Good day everyone, I am Teacher Angelito and today I will be discussing the severe physiological damage of Kwashiorkor to different systems of the body. One of the first and most visible signs of Kwashiorkor is edema or swelling, especially in the feet, legs, and face. This swelling is not due to excess fat, but because the body lacks protein, particularly albumin, which helps keep fluid inside the blood vessels. When albumin levels drop, the fluid leaks out into surrounding tissues. As a result, children with Kwashiorkor may look puffy or bloated even they are severely undernourished. Another major effect is liver enlargement, known as hepatomegaly. The liver normally processes and distributes fats, but when protein is lacking, this process breaks down. Fats build up inside the liver, making it swollen and fatty. This contributes to the bloated belly appearance, which is a classic sign of Kwashiorkor. It is often mistaken for overeating when it's actually a sign of organ dysfunction. The skin also suffers. Children may develop scaly, flaky patches, cracks, and open wounds that take a long time to heal. These lesions may look like burns or peeling pains. The hair, meanwhile, becomes thin, dry, and discolored, often turning orange, yellow, or reddish. These changes reflect a lack of nutrients like protein, zinc, and essential vitamins, which are vital for skin repair and hair health. So, despite the visible swelling, children with kwashiorkor experience severe muscle wasting. The body breaks down its own muscle to get amino acid needed for survival. The arms and legs become thin and weak. In addition, physical growth slows down or stops completely. Bones may become fragile, and height and weight fall far behind normal standards for their age. This is a clear sign of chronic malnutrition. It truly says that proteins plays a major role in keeping the immune system strong. Without it, the body becomes highly vulnerable to infections. Even common illnesses like colds, diarrhea, and skin infections can become dangerous. In severe cases, children may suffer from pneumonia, sepsis, or life-threatening conditions. The body lacks the energy and resources to defend itself, making recovery from sickness very slow or even impossible without intervention. So, kwashiorkor also affects the brain. Children may appear tired, uninterested, or withdrawn. They may cry less, stop playing, and show less curiosity. This is more than just mood. It is a sign of cognitive decline. A lack of protein during critical stages of development can lead to learning disabilities and delays in mental growth. These effects may continue even after treatment, especially if the condition lasted a long time. To summarize, kwashiorkor causes a wide range of physiological problems: swelling from fluid imbalance, fatty liver and bloated belly, skin and hair damage, muscle loss and stunted growth, weakened immunity, and cognitive delays. All these effects due to one main issue: protein deficiency. And yet, kwashiorkor is preventable. With proper nutrition, early care, and community support, children can recover and thrive. This condition reminds us that food is not just about filling the stomach. It is about building and protecting the whole body.
Kwashiorkor does not have a cure in the conventional sense like an antibiotic cures an infection, but it can be treated and reversed if identified early and managed properly. Kwashiorkor can be corrected by eating more protein and more overall calories, especially if treatment is started early. Although kwashiorkor is a condition that relates to malnutrition, merely feeding a child or adult will not correct all of the deficiencies and effects of the condition. If a child has been living without sufficient protein and nutrients for a long time, they can find it difficult to take in food. It is therefore essential to reintroduce food carefully to avoid refeeding syndrome. Refeeding syndrome involves life-threatening electrolyte and fluid shifts that occur with rapid feeding of malnourished individual. So for the complications of kwashiorkor, this will be discussed by your teacher, Ratzel.
So, hi everyone, I'm Rachel Martinez, and before we discuss the complications of kwashiorkor, did you know that many children with kwashiorkor will also develop lactose intolerance? As a result, they may need to avoid milk products or take enzymes so that their body can handle milk. So, doctors treating the condition will first give carbohydrates, then add in proteins, vitamins, and minerals. The reintroduction of food may take a week or more to accomplish safely. So, if a child's condition is so advanced that they are in shock, with low blood pressure and a high heart rate, they may need to take medication to support their blood pressure. So without treatment, kwashiorkor can lead to the following complications. So first, we have the cardiovascular problems. Cardiovascular problems issues that affect the heart and blood vessels, such as low blood pressure or heart failure. So second, we have the urinary tract infection or the UTI. So infections that affect parts of the urinary system like the bladder or kidneys. Next, we have the gastrointestinal problems, problems in the digestive system like diarrhea or poor absorption of nutrients. And number 4, we have the unenlarged liver known as hepatomegaly. It is a condition where the liver becomes bigger than normal. So loss of immune system function, the body becomes weak and cannot fight infections properly. 6, impaired cellular functions, the cells in the body do not work as they should. And lastly, we have the electrolyte imbalances. Electrolyte imbalances, the levels of important minerals like sodium and potassium in the body become too high or too low. So children with Kwashiorkor may not grow to an expected height due to malnutrition at an early age. The condition also makes a person more vulnerable to infection, which alongside a weakened immune system can lead to life-threatening complications. Early diagnosis and treatment will improve a person's outlook. Effective treatment can usually reverse many of the signs and symptoms of Kwashiorkor. It is important to reintroduce food slowly and carefully to avoid refeeding syndrome.
We hope you learned something from us.